Well, hello, Dr. Barber. Thank you again so much for joining me. Living Encouraged with Linda Michelle. And again, this is just what I'm calling a casual conversation of wisdom and encouragement for dementia caregivers. And I am so honored that you're going to share your expertise on the grieving process, because there's so much to that. But if you would just start by introducing yourself for those who don't know you, and they're going to get to know you a lot because we're going to do a lot together, because you have so much wisdom to share. So please introduce yourself.
Thank you so much, Linda Michelle. It's a pleasure to be here. I'm always so excited when I meet with you. I'm always so thrilled when we come together and share because we have so much to contribute, so much to give to society, so much to help to impact other people's lives. And we operate from a different sphere, but yes, I am a grief educator. I am a counselor, a registered clinical counselor, and did my PhD. I write my thesis on grief and loss. So I love that area of counseling because it's an area that is not dealt with to me fairly. People are not quite sure how to respond to grief. Even the grieving person does not really know how to, because of the stereotype that is being placed on how people should grieve, how long people should grieve, what shouldn't be done, and all that kind of thing, and which makes people who are grieving feel guilty about
Mm,
grieving. So people do not want to because they feel that they're doing something wrong.
mm,
The fact that I started or I was uh to me was motivated to go in this field because of my own loss with my dad
mm.
and how I was treated, like how I was told by the
Wow.
people I taught or the organization I taught would have been a support that I should get over it and move on with my life. And I thought, how does one do that? And this was within months after my dad passed away. And then my mom passed away after that, then my aunt and my brother. And then I realized that because when my brother passed away, which was within a certain amount of years after my mom and my aunt, I thought people does not get over grief
Mm,
because you as things happen, you it actually reignite
mm,
the process. So when you think it's okay, you're fine, and another situation occurs, you realize that no, I wasn't. Maybe I was
wow.
just in that place where I had not allowed myself, but trying to please society,
Mhm.
please others by trying to not allow myself to grieve. Because when my brother passed away from a massive heart attack, I was
Mm,
really devastated. And that's when I decided, no, I need to write about this. I need to talk about this. I need to help those who are going through it. And
yeah.
at the same time, in the workplace where you have to be present within a few days and act normal. So with all these things, I'm thinking, how does one act normal within a few weeks or days after losing their loved ones and function effectively
Yeah.
and still you go home and you have to face the reality of that loss. So that was what really pushed me. Said you say we are the solution to the
Mm,
problems that we face.
mhm.
Every problem has a solution, and I think that was what brought me into this space of grief and
Wow.
loss.
I am so sorry for your loss. And with that, I'm so thankful that you did exactly what God encourages us to do, to trust Him to work all things together for good.
Yes.
It's not good that your loved ones passed away, but that is a part of life. But what
Exactly.
is good is that you took that and you recognized what was happening to you, and then you and started doing something to empower others. There are a couple of things that you said that were so amazing. When you're in grief, sometimes you don't realize it. You're just in that space. Excuse me, and then you are expected to continue. What I am realizing now is that I am currently in living grief, and I've been in living grief, what I'm calling living grief, and I think you call it anticipatory grief.
Yes,
I dealt
anticipatory
with,
grief.
yeah, I helped my mama and to care for her for over 10 years. And then before then, it was my mother-in-law, and then my grandmother, and then since then, my uncle, and now my husband. And when mama passed in 2022, my husband had already been diagnosed with Alzheimer's, and it was progressing. Of course, it was minimum at the time, but then it started progressing. So dealing with him and mom at the same time, I think it was 2020 when the official came down. Taking care of mama, traveling from Michigan, from Atlanta to Michigan to help take care of mama, then working as a flight attendant in Newark, and then doing that triangle. Um, not really being and seeing what my husband was going through every day, trying to process, but still seeing the loss. There was a lot of grief going on. And this is taking me to a lot of different places of my thoughts. And then just most recently, you were so kind to lend your expertise and your wisdom when I received a call that a precious friend of mine passed away. Over 30 years, we've been friends. And every year we would send Christmas cards with a long letter and pictures of our families and an update of what's been going on in that year. And it caught me off guard. When I got the news last week, it really hit me hard. And Dr. Barbara, it kind of put me in a place where I couldn't move. I felt like, but I had to get up and I had to go and be with Robert and help take care of him, because at the nursing home, at the nursing facility where he is, they're so understaffed. Um, and yet I had to come to grips with what I was processing, what I was feeling, and I didn't really know. I didn't really understand it. So I reached out to you, and you gave me some phenomenal wisdom on letting myself just grieve and letting myself, giving permission. So let's start there. What does a person do, or you can even share what you share with me as far as being in the middle of grief and allowing yourself to feel what you're feeling?
So, if it like because your mom just basically it's recent. That's very recent that you lost your
Yes,
mom. So I really
yes.
empathize. My condolence. Um,
Thank
and
you.
saying that you were caring for different family members as you go through the different stages and as one passed the other. So it's like the time frame in which your family members, and these are very close people to you, pass. Um, it's and in the midst of that, your husband, Robert, was diagnosed with dementia,
Mhm.
Alzheimer's, right?
Yes, ma'am. Yes,
So
yes.
it's like when do I grieve? Where do I find time to grieve? Who do I grieve?
Mhm. Wow. Yes.
Is you understand? Like
Yes.
this is an ongoing process, one after the other. And how do I really even allow myself to accept that grief is part of the journey that I need to go through? Because you're trying to be strong for Robert and strong for yourself and strong for the job and strong for everything else, without even allowing yourself to go through having the
Mhm.
dignity of grieving, because as you journey through grief, this is what brings healing.
Mhm.
Healing comes after. It's like having a wound, and they have to clean that wound and the pain you go through, and in order to make sure that bacteria doesn't
Mhm.
kick in. So if that wound is not properly clean, and you have to endure the pain of
Wow.
that being done in order for it to be healed.
Wow.
So you were not allowed to basically, based on what's going on, to grieve properly in order to get to that place of healing for yourself.
Mm.
So right
Mhm.
now, as you're going through even the anticipatory grief, because Robert is still alive, but you've lost your companion to be able to relate to. You have lost
Mhm.
the friendship, that close friendship and bonding of coming in when you're tired from work and to
Mhm.
share what your day was like, to have somebody to understand. Your grievance is health deteriorate, and economically too. I guess it could have some impact on you.
Mhm.
So there's so much
Yes.
lost right there that you
Mm.
are dealing with and caring for him, and to watch him deteriorate,
Mm.
giving him the support and the love that he needs. In the meantime, caring for yourself, loving
Mm.
yourself. So there's so much that's going on within that particular circle of, or the
Mm.
journey of your
Yes.
grief. And this is why it's good to have support. It's
Mhm.
good to have people around who understand, because sometimes you just need somebody to listen to you talk. You just don't, it's not that you're asking people for advice. It's just somebody to
Mhm.
witness what you going
Yeah.
through. Somebody who, as you talk, can validate the pain you're feeling
Mm.
just by listening and allowing you to talk.
Mhm. That is so
Somebody,
true.
or even to say, okay, to you're coming from work, or Robert is there, to say, can I go and spend some time with him while you take some time off? Somebody
Mm.
even to say, I make some meal, or bring something over, or to say, let's go out.
That is so important. That is so important. We're
Let's
going
go
to take a
out.
Let's go. We're going to take a pause to hold that thought, and we're going to come back in just a few minutes so you can continue. This is absolutely awesome wisdom. So stay tuned.
Thank you.